infection. So looking at the symptoms and diagnosis, in the diagnosis, the various methods are, first of all, the most important one for a dermatologist is clinical examination, which is visual inspection, dermoscopy to closely examine the hair follicles and surrounding skin, and swab cultures to identify the causative bacteria, especially if the infection recurs or does not respond to initial treatment. Now, the clinical presentation, the appearance, as I said, is small red or pus-filled bumps. Location again is areas with hair growth, commonly the scalp, face, neck, chest, and back. Sensation, you'll get itching, tenderness, or pain. And additional signs are, in severe cases, what you get are severe, larger, painful boils can form. So this is a kind of a complication that's going to occur. Now, regarding treatment, there can be topical treatment. So the simple antiseptic washes like chlorhexidine, benzoyl peroxide, topical antibiotics like mupirocin and clindamycin, oral antibiotics which are prescribed for severe or widespread infection like dicloxacillin and ceflexin. Regarding other management, remember that hygiene and regular cleaning of the affected area is important. Avoid shaving, friction, and occlusive dressing until healed, especially when you have folliculitis. Warm compresses are important because they do elevate the discomfort and promote drainage of pus. So, what happens again in the prevention? Hygiene is important, just regular cleaning with soap and water. Clothing, avoid tight clothing because these can cause friction. As I said, for shaving, use clean razors and avoid shaving too closely. Skin care, avoid occlusive oils and lotions. A very important advice is, we like using vegetable oils like coconut oil, mustard oil, but in summers you have to be careful. It can lead to folliculitis. Environment, avoid hot tubs or pools with uncertain hygiene standards. So complication, of course, is there can be recurrence of these lesions, repeated episodes of folliculitis, abscess formation, so you have development of painful pus-filled lumps which would need surgical intervention, scarring, that is permanent marks left after healing, and cellulitis, there are deeper skin infections spreading to surrounding tissues. So let's have a look at a case study. There's a 35-year-old male who has symptoms of multiple small red and itchy bumps on the upper back and shoulders. So these are small little itchy bumps. So clinical examination and swab culture confirms Staphylococcus aureus. So they are little folliculitis. So topical mupirocin and oral dicloxacillin was given for 7 days. This leads to a complete resolution of the symptoms with no recurrence after 6 months. This brings me to deep folliculitis, which is again a severe form of folliculitis where the infection extends deeper into the hair follicle and surrounding tissue. So there is a little bit of an erythema and edema even in the surrounding tissues, and there are painful red, sometimes, solar nodules when they occur, in quick vicinity of each other. Now, causes, again, the primary cause is bacterial infection with Staph aureus being commonest, but you can have other causes also like fungal infections like malassezia or dermatophytes, viral infections like herpes simplex infection, and parasitic infections, demodex mites. So if it is not going with the antibiotics, you need to have a relook again. So risk factors are skin trauma, which are cuts, abrasions, insect bites, tight clothing to be avoided due to friction, immunosuppression, diabetes, HIV, AIDS, other conditions weakening the immune system, poor hygiene like inadequate skin cleanliness and close contact exposure to infected individuals or contaminated surfaces. So again, what do the symptoms look like? What is the clinical presentation? You have large red and tender, folliculitis, which is in close vicinity, and they may look as tender nodules. Location is commonly, it affects areas with dense hair growth like scalp, beard area, thighs and buttocks. Sensation, there's severe pain, itching or tenderness. Additional signs, look out for fever and malaise if the infection is extensive. Diagnosis is again by clinical examination, swab cultures to identify the specific bacteria. In chronic or unclear cases, you may need to rule out other conditions. That's when a biopsy comes in if you have a differential diagnosis. Blood tests, especially blood culture if a systemic infection is suspected, and imaging by ultrasound or MRI may be used to assess the extent of deep infections. Now, regarding treatment, there are certain self-care measures like warm compresses and hygiene which has to be maintained. Medical treatment, you may need to do an incision and drainage. Antibiotics, oral or topical antibiotics for severe, recurrent or multiple cases like dicloxacillin, ceflexin, clindamycin. Bactrim, that is trimethoprim sulfamethoxazole for the methicillin-resistant Staph aureus. Antifungal treatment, antiviral treatment. If it is needed and you suspect that that's also a part of the lesions. Pain management, you can give pain relievers like ibuprofen or acetaminophen and topical steroids sometimes to reduce the inflammation and itching. You don't give them in routine practice otherwise. Prevention is, of course, good hygiene. Avoid sharing personal items like towels, razors, clothing. Proper wound care, clean and cover any cuts or abrasions. A healthy lifestyle, maintain a strong immune system through a balanced diet, exercise, and adequate sleep. Manage chronic conditions like diabetes and other conditions. Complications, again, if you don't treat well, you go into the next level of the bacterial infections, which are carbuncles. This is a cluster of interconnected furuncles leading to a deeper, more severe infection. So what happens is, if you start off with folliculitis, as more and more follicles get involved, you have the carbuncles or you have the furuncle. Abscess formation, cellulitis, the spreading of infection to the surrounding skin and deeper tissue, and it can resolve with a scar. So then you need to treat the scar as well. And finally, sepsis, because rare but a serious systemic infection, septicemia, which can be life-threatening. So this is another case study, a 38-year-old male with a history of eczema. There's painful swollen nodules on the neck and shoulders accompanied by fever. Clinical examination and swab culture confirmed Staphylococcus aureus. So here again, because it's a painful swelling, again, it may be a deeper bacterial infection. It can be a carbuncle. So incision and drainage, oral antibiotics for 10 days and topical steroids to reduce inflammation. Outcome, successful resolution with no recurrence after 6 months.